So I posted this on my stories yesterday, thing number a bajillion that they don't teach you in nursing school, how to apply leeches. And so many of you were like, what are you even talking about? Let's talk about leech therapy. Also, I'm going to be showing some kind of sensitive images, so just be mindful. If someone in nursing school would have told me that applying leeches to a patient's wound was going to be part of my nursing scope of practice, I would have been like, what? So what is leech therapy? Leech therapy is something that is used on patients with wounds that need some extra sort of healing. So for example, like plastic surgeries, any sort of wound surgeries that need special healing, grafts, etc. So what leeches do is they attach themselves to the wound and they suck and draw blood, but they also release proteins and peptides that help thin the blood, like an anticoagulant, prevent clotting, and this helps improve the circulation and blood flow of that area, which is awesome when you're trying to, maybe have like a graft or something that you're trying not to get rejected because you need that blood flow and perfusion to that area. Okay, my friend Gia actually taught me this, so I'm gonna tag her because she's obsessed with leeches, and I'm like, you're crazy. But she told me this. Leeches have 3 jaws of tiny teeth, and they attach to the person's, wound area, and their saliva has the anticoagulant. So then they're sucking some of the blood clots, but they're releasing the anticoagulants into the patient's skin or wound. So they are attached for usually like 20 to 45 minutes. And when they're like full, they will like let go. I'm not even kidding you. Gia took this picture at her work a while back. Like, look at this trail that this leech left. I can't like make this shit up. Here is a leech. I didn't take this photo. It's from the internet. Of a leech that's like on a wound right here. I'm not sure 100% what type of surgery this is, but looks like some sort of plastic reconstruction surgery. And so I'm assuming this leech is trying to, prevent that good circulation to that patient. So when you're applying the leeches, all you do is you have to get like little tweezers and you pick them up, and then you just place them on the targeted area and they should like adhere. I didn't know this until like literally a couple of days ago. I knew we had leeches at the hospital, but I didn't realize that we literally like store them in our pharmacy like at all times. Like we just have a tank of leeches. All right, that's enough on leeches. Let me know if you have any questions.